The Northfield Holistic Health Summit 2024 was pleased to host Dr. Noel Aldrich with his presentation, Nutrition, the Cornerstone of Health. The following is a recording of this presentation on May 4th, 2024.
Dr. Noel Aldrich grew up just south of Northfield on a family farm. There he enjoyed open spaces of the farm setting, working with nature, receiving the benefits of home-cooked meals. After college and beginning to establish his own adult life, he adopted the convenience of modern lifestyle, not realizing what it was beginning to do to his health. Today, Dr. Aldrich will share part of that journey and help provide a new perspective on the importance of nutrition for having a thriving life. Please welcome Dr. Noel Aldrich as he presents Nutrition, the Cornerstone to Health. Dr. Aldrich.
Thank you. If you're one that likes to take notes, there is a note sheet on the pedestal in the back there. Just a simple one-sheet note to keep track of things as we progress here today on this topic of the cornerstone of health. I'm not going to be using a lot of scientific words today. You've already had some great sessions and gotten deep into Latin terms and biophysics and everything like that. I'm going to help us come to a landing here, perhaps, as we talk about nutrition and the concept of a cornerstone. So, where is a cornerstone located? Where do you find a cornerstone? At a corner. At the foundation, so down low at the very beginning, right? What is your cornerstone? What do you find when you dig down and go deep into the layers of your life? Because the purpose of a cornerstone here is to be foundational. It's also to be bidirectional. It's going to determine where the straight lines are in each direction. It's also going to be supporting for everything else that happens for that structure. And so I'm thinking about our lives as that structure. What is the cornerstone that's supporting everything that makes you who you are? As was mentioned in the introduction, I had a cornerstone established with my family life. I didn't even realize how important it was. And then as I began to do my own things independently as a mature adult, I'm finding out how important that cornerstone was. Cornerstones set the intention. What kind of structure are you going to build? How big is it supposed to be? How energetic is it supposed to be? What is its purposes going to be? Some purposes are bigger than others. So, what are your goals for your life? Those goals that you're thinking about, especially as we're entering into the spring and summer season now, what do you want to accomplish? You want to accomplish those with a healthy body, right? Because any other type of illness is just going to slow that down, keep you from reaching those goals. You are designed for a purpose. You have a specific purpose to exist here. What are the pieces there that are going to need to be filled in to make sure you can reach that purpose? Here's part of my purpose. And as I met my wife over 23 years ago, we got married, and I didn't realize there were still some missing pieces. One of those missing pieces wasn't made relevant or obvious to my wife and I until the first pregnancy. And I get the news from my wife, we're expecting, We go to the doctor and confirm. So I said the next step is the ultrasound. We get the ultrasound. Now I need to prepare being a daddy. Except that 2 weeks later, we lost that child. So that baby is not in this picture. But that baby made an impact, totally changed our family's life and made it possible for the rest of us to live healthy. So even though that life was very short, that life had a purpose. It was to get my attention. Say, hey, there's some things you need to check out. And so how did we check that out? We were referred to a doctor of women's health who specialized in nutrition. When we met with her, we had a consultation for a whole hour. And we left with this prescription slip that said, go to the grocery store and buy these foods and stop eating those foods and watch and see what happens. First time I'd ever seen nutrition therapy as a way to reach our goals, as a way to establish a foundation. We did that, and there's a result. Our family has grown. Our family has matured. Our family is healthy. The cornerstone got set after that loss of the first life. So, thinking about missing pieces. You're familiar with Jenga, perhaps. Maybe played it a few times. But the challenge of that game is how many pieces can you really remove? Have you ever thought about that for nutrition? I don't need that one. I don't need that one. What's going to be the result? Sooner or later, crash. Have you experienced a crash in your life? Most of us have. At some point or another, and we realize, there was a missing piece. So my presentation today is to look at that missing piece, the nutrition part of it. How do we look at nutrition? So there's 3 different pieces that I want to outline for you today of what nutrition is. Often we think about nutrition is vitamins and minerals. That's what all the nutritionists talk about, right? And there's a lot of validity to that. That's the chemistry that we know. It's amazing that nutrition itself was not really a study or an understanding until the early 1900s. Before that, we didn't have the chemistry ability to understand all these molecules. We just knew that certain foods, certain teas provided some benefit. Now we have the chemistry to be able to understand some of this, of the vitamins and minerals. So we could start beginning to talk about all those different vitamins and minerals, and it might begin to look like a chemistry periodic table. Some of you like that. Most of us maybe don't. But this is just a small section of some of those different types of vitamins and minerals that are essential for health. You recognize the bottom level there of all the different B vitamins. We call this the B complex. Then we move into some of the minerals, and in the middle there we've got the fat-soluble vitamins and some more minerals on top. What are some of the missing pieces that we see with different types of illnesses? Like ADHD. It's very common in ADHD that we'll find magnesium or zinc deficiency, or just that this person with their genetic makeup need more of the magnesium and zinc than others. The same with B6 and B9. That these are important for this individual to help keep focus, to help move on in life and be productive to reach their goals. How about diabetes? Diabetes is one of the leading health challenges these days. There was a time when that was not the case, but now it is. What are we missing? What more nutrients do we need? Everything in red here are those nutrients that are commonly seen as either deficient or that person needs more of this than others. Magnesium is one of those minerals that helps generate energy. So as the sugar comes in and gets processed into energy, it needs to attach to a magnesium. Vitamin D, as a fat-soluble vitamin, is working with the pancreas to help it function correctly to produce that insulin. And you see some more B vitamins, B2, B7, B12. All of the B vitamins are part of the chemistry cycle that takes that sugar molecule and turns it into energy. If we don't have all of those B vitamins, then that sugar is just going to stay around either in storage or in the blood flow, and that's what creates problems. We need to get it out of the bloodstream into a pathway where it's going to be able to be processed and turned into energy, and the B vitamins are necessary for that to happen. Or how about high cholesterol? The use of statin medications to keep this under control has risen to be one of the most popular medications being used. But these are some of the minerals and vitamins that are also known to be deficient or more necessary for someone who is dealing with high cholesterol, high LDL, high total cholesterol. And I put the CoQ10 in yellow here because this is an interesting challenge with the drug-nutrient interaction. Often when you go to a medical doctor who's going to say, yep, you have high cholesterol, here's the medication we're recommending, which is some form of statin. Many of those statin medications are also going to turn off the production of CoQ12 or CoQ10. CoQ10 is an important molecule for us to produce energy. And so with the, you're getting your cholesterol numbers lowered by this medication, but you might also be lowering your CoQ10 as well. If the medical doctor is aware of this, they will recommend, well, make sure you take some CoQ10 as well, but not every medical doctor is knowledgeable of that. So for each one of these different type of health challenges, consider that there could be some drug-nutrient interaction going on that's going to make some of these nutrients less available or used up more quickly, and we need to take more medications to be able, or more nutrients to be able to cover that, cover all the bases, to fill in the foundation here. Also depression. Depression is related particularly to the B vitamins, that we're low B vitamins, as well as some of the minerals here. We know that vitamin D in the middle is often one of those nutrients we need, especially for the individual who has seasonal affective disorder. They need to get more of that vitamin D during the winter months when the sun is not shining as strongly as it is in the summertime. If we take more vitamin D during the winter, that'll help bring the moods back up. But also the B vitamins, and you see it's almost the whole row of the B vitamins here, so a good B complex is helpful again to generate that energy. Because if I'm in depression, I don't feel like doing much, I don't want to go out and do things, it's related to energy and fatigue. So I want to fill in the foundation, fill in what's needed here. High blood pressure. Here's some more nutrients. Again, the B complex, magnesium, zinc. What I like about magnesium is to understand that this is the mineral that our body uses to help relax. Every time you constrict a muscle, that takes calcium to constrict it, but to relax those muscles again takes magnesium. So if someone goes into the emergency room with a heart attack going on, high pressure in the chest, very often one of the first procedures they'll give is IV magnesium to help them relax, help them get the muscles more relaxed and out of the tense situation that they're in. Also, calcium is helpful for that as well. And if they're high blood pressure, they're probably low on CoQ10. So these are just examples where individuals are missing these links in the Jenga tower, and you pull enough of them, and pretty soon the crash is going to happen. Headaches? How many have headaches? For one thing, headaches might simply indicate you need to be drinking some more water. I encouraged all of you who got my email, make sure you bring your water bottle today so that your head doesn't start hurting from all this information. We already mentioned magnesium as something that helps you relax. The magnesium is also good for the brain as well, for relaxing. There is this particular magnesium, magnesium threonate, that has been identified as particular to be delivered to the brain and help it relax there. There are many different types of magnesium supplements. Some are absorbed more easily than others. Some are used in different parts of the body than others. So magnesium citrate, magnesium glycinate, magnesium threonate. Probably one of the least absorbed ones is magnesium oxide. There are even some supplements now that will do all the different types of magnesium in one capsule just to try to cover all the bases, and that works fine too. But also notice up there, vitamin C might be one of those vitamins your body is a little bit low on, and that could help your headache as well. So maybe our plate should look like this. That would fill in all the gaps, right? Would it be enjoyable? How many of you enjoyed lunch today? There wasn't a single pill on that plate, was there? Dr. Terry Walls was diagnosed with multiple sclerosis before 2007. This is her picture in 2007. She's a medical doctor down in Iowa. And as a medical doctor, she had access to all the medical school information. She could find out exactly what are the nutrients that we need to help support multiple sclerosis. Because as you see, she's sitting here in a zero-gravity wheelchair, so moving around with this mechanism to be able to keep doing her clinical work as much as possible. But she's declining. And here in 2007, she had identified all the nutrients that she needed, everything that should go on her plate, and was taking them. And she observed that her multiple sclerosis stopped declining. It leveled out. Up to that point, she's been taking every medication that all the leading doctors had said for MS, and it just kept getting worse and worse. But then she identified all the vitamins she needed, all the minerals, and now she plateaued. That was good, but that wasn't getting her out of the wheelchair. So she took it the next step. All right, if it's not just the vitamins, where do these vitamins come from? What foods are they concentrated in? And so she started eating those foods. And this is Terry Walls the year later. Riding bike, enjoying riding horses again. And she now does a speaking circuit around the country. She has a TED Talk where she talks about this, that she found a healing take place by finding the foods that had all those nutrients in it. So the nutrients are important, but it's also the package that those nutrients come in. And as you experienced in lunch today, that package was much more enjoyable than just a bunch of pills on a plate. That's the way God designed it. So not only has she improved her own health, she still needs to manage her MS, but she is now back in the research lab, back operating a clinic in which they've developed the Walls protocol, and they are doing active research for any MS client that wants to become part of this research down in Ames, Iowa. and they're following the WALS protocol and observing very similar results for other MS clients around the world. It's the whole foods. That's the package that we need to be looking at. So nutrition is vitamins and minerals, but it's bigger than that. It's the food sources that it comes in also. You're going to come across terms like phytonutrients or bioflavonoids, flavanols, and all these other terms that even as nutritionists, we don't know everything that they do, but we have observed that they're helpful to the body, and they're packaged in the foods. They're not packaged in the capsules. So we're in a classroom here. Let's talk about some different food sources here. The highest sources of vitamin C are going to be citrus, peppers. Okay, some of you have been listening to me. That's good. Peppers, one of the highest sources of vitamin C. More than oranges, more than any other fruit, actually, and less sugar than any of the other fruits. So if you want to keep your sugars low and your vitamin C high, you want to plant some of these in your garden this year. And you want to buy those from your market. Another vitamin C source. Strawberries, as far as fruits go, one of the highest sources of vitamin C, even more than oranges. And broccoli is also a great source of vitamin C. You can enjoy it raw, you can enjoy it cooked, it's still going to deliver vitamin C for you. And another interesting thing about broccoli, and for most of these plants too, the broccoli seeds, if you sprout them, the sprouted seeds actually have more power in them than mature broccoli. You think about all those seeds that we're putting in the garden, all the minerals, all the information that's needed for life is in those seeds. So when you sprout them and they're first coming out, that's the most concentrated source for those seeds that you're going to be able to enjoy. And you can eat broccoli sprouts with a salad, make a soup out of it. It's going to be a great source for you. High anti-cancer potency with the sprouts. How about vitamin A? I'll ask first, what is vitamin A important for? Eyes, yeah. Even with glasses, you still need vitamin A. Vitamin A is a fat-soluble vitamin, meaning that you need to eat some fats with your meals to help this get absorbed more effectively. So that's one of the reasons why you had an olive oil vinaigrette with your meal today, to help get that vitamin A absorbed into your intestines. Vitamin A is great for the eyes. It's also very important for the immune system. It helps your lungs to function more properly. And here's one of the highest sources of vitamin A, beef liver. Oh, your favorite, right? Actually, any liver, chicken liver, goose liver, duck liver, you can choose. They're all going to be high in vitamin A because the liver stores a lot of the fat-soluble vitamins. So liver is always a good source. I understand not liking beef liver that much. It's not one that I'm going to go to every week. My preference is chicken liver, but I do recommend when you cook up liver, you do it with liver and onions and bacon and get as much flavor into that as possible, and that'll make it much better. But you can also do liver pate. Just puree it all into a smooth paste that'll go on your crackers, go on your bread, and that can be delightful as well. Another great source of vitamin A is herring, as well as salmon can be another source because these ocean fish are rich in fats, and so as a fat-soluble vitamin, you'll find vitamin A in the herring. and in the ricotta cheese. A lot of the cheeses have good vitamin A concentrated into them because all of the milk has coagulated around those vitamins, and so you're finding that here in the ricotta cheese. Vitamin B1, also known as thiamine. I like to pick this one today because as I have clients come in to the clinic, often we'll do a blood test to see how their metabolism is working and what's off balance. And in the functional test that we use, the doctors provide an evaluation stating which vitamins it looks like this client would be most helped by. And thiamine comes up quite frequently. One of the B vitamins within the B complex is an important vitamin for generating energy, processing energy correctly. And this, can you recognize that picture? Black beans, one of the richest sources of thiamine. It's also going to be a great source of protein and an excellent source of dietary fiber, soluble fiber. Beans are one of the most concentrated sources of fiber of any of the foods that we can consume, and you want to get around 35 to 40 grams of fiber in your diet every day. Soluble fiber is going to act like a sponge or scrub brush and go through the intestines, scrubbing, cleaning out the toxins that are trying to hang out there, absorb them like a sponge, and take it out with the next bowel movement. So your body does not digest fiber, but it uses it as a way to get rid of junk. And we all have some types of junk. Then, closely related to that's going to be lentils. It's in the legume family as well, so it's also going to be high in protein, also high in soluble fiber, and a great source of thiamine. And then sunflower seeds will also be a great source for thiamine. Vitamin D. Why do we need vitamin D? Anyone? Helps absorb calcium. I heard bones there. Yep. So if somebody is concerned about their bones getting weak as we get older, calcium might be one of the considerations, but I would not take calcium alone. You need vitamin D and you need vitamin K, both fat-soluble vitamins, to help direct that calcium where it needs to go. If the calcium's going in as a supplement all by itself, what we are often observing is the calcium just ends up on the coating of the blood vessels and promotes a calcification of the blood vessels. The blood vessels then get stiff and not flexible like they're supposed to be because they didn't receive any directions. The vitamin D and the vitamin K weren't there to direct it where it needed to go. So you can take a lot of calcium and still not see those bones get strong because the other vitamins weren't there. What's going to be a great source of vitamin D? The sunshine, yes. So, there's the sun on cue. We need to just go outside, put on our shorts, short sleeve shirts, and get some sun, right? How about in January? Not as convenient. In fact, there's been some studies showing that some of the cancer rates can actually be tracked by the latitude that you live in. The farther north you go, the higher the cancer rates compared to closer to the equator, because those closer to the equator get more sunshine, get more vitamin D produced as their skin gets exposed to the sunlight, ultraviolet rays penetrating their skin and making vitamin D. Making vitamin D out of cholesterol. Cholesterol is one of the important molecules to make that vitamin D. But we do love Minnesota, so I'm not planning to move to Florida at this point. There's our option. Cod liver oil, just like Grandma used to talk about. Now you get lemon flavored now, it's a little milder, easier to use, but cod liver oil is going to be one of the easiest sources, one of the most concentrated sources of vitamin D that you can get. I will comment on supplements that you want to look at the labels carefully. Every different company that makes cod liver oil is going to have a different percentage on their ingredient list, on their nutrition label. So the Carlson brand is always 400 IUs. That's a nice dose. You can actually take 1,000 IUs a day, and that's not a concern. Some doctors will even talk about 5,000 IUs a day, but 1,000 to 2,000 is pretty consistent. And I would recommend cod liver oil because it's got the vitamin D, it's also got vitamin A, and it's got the fish oils in it. All of those combined together. Many of you are taking fish oil right now, and that's a good supplement to have for fatty acids, but here you can also get the 2 fat-soluble vitamins that are going to absorb with that fat and get right into your cells to get the directions that they need. So the question is, does sunscreen interfere with making vitamin D? Yeah. So we want to find a way to help get the most vitamin D, but not create a lot of sunburn either. Some of that is more of timing of when you're exposing yourself to the sun. Can you get exposure to the sun before 10 a.m. in the morning or after 4 p.m. in the afternoon so that you are getting some of that intensity without the overwhelming piece of it? And as you do more of that, your skin will begin to tan more and become more resistant to burning and be able to handle that. The higher your vitamin D levels, the less the concerns of skin cancer. And to look up more on vitamin D, I'd encourage you to Google vitamin D and grassroots.com. They've been doing vitamin D research for years and also offer vitamin D test kits where you can do a blood spot on a card, send the card in, and they'll tell you how much vitamin D is in your blood. You want to have it somewhere between 40 and 80 nanograms per deciliter of vitamin D. That's considered the quality level there. One of the things that we observed during COVID was those individuals that had less than 30 nanograms per deciliter were more likely to be in the ICU, and many of them never came out of the ICU. It was very closely related to vitamin D levels. Also, eggs can be a great source for vitamin D, especially if those chickens are running around in the pasture, getting some sun exposure themselves. That's going to be a great source of vitamin D.
How do you use that cod liver oil?
Just by the spoonful. Yep.
And what's the brand?
So this is Carlson brand. Just comes in a green bottle, yellow cap. Most of the markets around here carry it. Just Food carries it. Valley Natural carries it. I also like Nordic Natural as another brand that comes in a blue bottle, and one of their products is called Arctic D. So that emphasizes more of the D concentration. It's 1,000 IUs of D within the Arctic D, 1,000 IUs per teaspoon. So 1 teaspoon, 2 teaspoons a day would be fine.
So if you by having the cod liver oil where you say it has your vitamin A, vitamin D, and fish oil, you would not need to take the fish oil separately?
You would not need to take a separate fish oil. That's correct. Mm-hmm. Food sources is something that captured the attention of Dr. Weston Price. How many of you have heard of Dr. Weston Price before? Okay. About 5 of you. So I want to let the rest of you know and Google this man, look up the research on this man. He's from the 1930s, as you can tell with the picture. He was an excellent dentist. He was also a researcher. And so he did research along with his clinical work. And one of the things he was noticing was more and more of his clients coming in with cavities, more and more of his younger patients coming in with crowding of teeth. And he's going, why this increase? What's going on? And so his research took him around the world. Evidently, the clinic was good enough that it supported his travels around, and what he did was went to different places in the world where there was no Western food supply. It was just a culture that they were existing on their own natural resources and knew how to care for those natural resources and what to prioritize. And so he went to the Aborigines in Australia. He went into the African countries to see how the tribes were working there. He went up into Canada to the Indians up there that had not yet gotten all the Western foods, and went over into Sweden, up in the mountains where some of the resources were limited. And what he found was those people were healthier than the people in the cities. Those people were healthier than those that had the modern conveniences. They had hardly any cavities at all, which means they didn't need to brush their teeth to keep away cavities. They didn't need braces. Their mouths were full and had all their teeth. And when he went to look into the cemeteries, which is an interesting thing to do on your travels, he found skulls of the ancestors also with hardly any cavities in their teeth, a full range of teeth. That's the way the society had lived, and they had good nutrition that was supporting that type of work. So his conclusion was that the modern processes that were beginning to take over were decreasing the mineral and vitamin quantities within our foods, and the result was a physical degeneration that was showing up in the arch of the mouth and with the teeth. And as the teeth are a indicator of how the rest of the bones in the body are, he was seeing the first signs of a big problem. So the Western Price Foundation was a group that has formed after he passed away, but they are continuing to promote his ideas. So you can Google the Western Price Foundation. They have charters all across the world in every country, continuing to promote this understanding that it is the food sources that we need to be going to get the nutrients. And this is his book, Nutrition and Physical Degeneration, where you will find the pictures in there, you'll find documentation of every one of his travels and his conclusions based on all of that research. So he documented this research very well. Which brings us to nutrition is lifestyle. What Dr. Weston Price was finding was a way of living and a way of identifying the foods that your body will really thrive on. And that's really the question that we're coming here today to talk about is, how will my body thrive? Our American lifestyle, convenience, processed, shelf-stable, fast food. These are the things that were beginning to happen as Dr. Price was doing his research, and it's only gotten much, much more so now, hasn't it? So that you will find in the literature, especially in all of the nutrition journals, the description, the standard American diet, which we like that acronym. It is a sad situation of our standard American diet, which has resulted in this type of trend from the 1990s, where only about 10 to 15% of the country was obese, which is the next category above overweight. And by 2020, there's not a single blue state left in there. It's all 25% or more. We've come to the next decade. That was 2010. 2020 was, I looked up those numbers, and the average state is 36% obese. An interesting discussion for percentages. I heard this one gentleman comment, well, what is normal? And his description was, well, normal is any percentage above 62% is considered normal. Well, we have 36% of the population that's obese, another 40% that's overweight. So we've got over 70% of the population of the United States that is overweight or obese, and that's considered normal. That's the type of thinking that we have to work with. Where back in 1960, diabetes was very uncommon. Only about 1% of the population diabetic. And now over 10% of the population is, and some numbers are saying we're looking at closer to 30% when you include pre-diabetes. Cholesterol numbers, as I mentioned, are going up so that we're seeing a rising use of statin drugs just to try to keep that under control when the statin drugs are not addressing the missing pieces. And non-alcoholic fatty liver disease. Fatty liver disease was something very common in alcoholics who was affecting their liver, and so now the liver was starting to store fat in the liver, but now we're seeing it in the non-alcoholic population. The liver is still storing fat within the liver. We were seeing it in some veterans back in the year 2003, and within just 8 years, it had more than tripled. And in 2019, the Journal for the American Medical Association said this is becoming the most common liver disease in children. So this is not just something that happens when you get old, but this is happening all across our age groups. One of the descriptions of this is the metabolic syndrome, which includes more than 50 million Americans with increased risk of heart disease, stroke, and diabetes. And the literature will describe this as lifestyle diseases. So all we need to do, which is very simple to say, but can I change my lifestyle and greatly reduce my risk for all of these illnesses? So I'm going to give you a quick 8 rules that I use with many of my clients. These are the general rules before I get into specifics with individuals. But number 1, eat exactly 3 meals a day, not more or less than the plan is prescribed. Number 2, ensure that there is a 5-hour break between the meals, allowing enough time for your digestive system to relax, allowing enough time for the insulin levels to come down. Only when the insulin levels are low enough will your body be able to switch gears and begin burning off excess fat. As long as the insulin levels are high, fat can't be burned. Number 3, make sure there's I'm not able to, let's see that. Yeah, the meal is less than 60 minutes. That's typically not a problem for most Americans. And then I begin every meal with protein. So my plate's going to have protein, carbohydrates, starch. It's going to be a very satisfying meal just like you had today. And I started with chicken salad. I started with the protein. And then I go around the plate, and then I come back and eat some more protein. You go to a restaurant, and what are the first things that go on the plate or on the table? The bread, the lettuce, the drinks. All delicious carbohydrates, but no protein. Protein is what your body gets signaled to go, oh, okay, this is satisfying. And it'll cause you to less chance to overeat if you start with some protein first. And then we have eating only one type of protein for that meal, and I don't repeat that protein the rest of the day. So I can go to a restaurant and I'll order a hamburger with the vegetables, and it's going to be very satisfying, but I wouldn't order a cheeseburger. So that's 2 different proteins at the same time. I'm going to focus on one protein at a time, and then that evening I'm not going to go home and have a steak because I already had beef. So I'll do fish for dinner, or I'll do cheese then, but do a rotation of proteins throughout the day that your body can use. This can also be an influence for allergies. One of the challenges going on is we have too many proteins in our meals. The next one there, all eating done by 9 p.m. Rule number 7, drinking the quantity of water calculated for you each day. So you take your body weight, cut that in half, and that's about the amount of fluid ounces you should be consuming for the day. And then everyone should eat an apple a day. It's scientifically true, an apple a day does help keep the doctor away. Even diabetics should be eating an apple. And with those rules, we begin to build a foundation to thrive. This is the program that I work with on clients, with the cornerstone of it being a metabolic balance plan, personalized plan based on your blood chemistry. We take a blood sample to find out what is off balance in your metabolism. I take those test results and send the data over to Germany, where they match it up with a food database. And that food database tells me exactly what foods your body would thrive on. And then we begin to build a menu plan based on those foods. 3-day menu plan, breakfast, lunch, and dinner. So I want to give you a case study here of Marty. Just started working with Marty this last year, 60 years old. And it was encouraging to me. He didn't have any significant heart or health challenges, but his goal was longevity. At 60-year-old, he wanted to enjoy life for a long time. We started in October with his weight at 202. This might be a little bit harder to see, but we just did his blood work again, and you can see a bunch of green thumbs up. This panel is the panel of all the different enzymes related to liver and heart health, and every one of them had improved in the last 6 months as he followed his personalized plan. Those 8 rules plus the foods that were identified as the best for him. This was the cholesterol panel. His LDL cholesterol went from 125 to 97. Excellent. His good cholesterol actually went up. And so that made his ratio come out even better. So again, all thumbs up. This is his CRP measure. Now, CRP is a measure for inflammation. Back in October, his inflammation was at 3.5, which is about 3 times higher than it should be. Now it's down to 1, so that was a very good improvement. He's just a tenth of away from being optimum as far as CRP levels are concerned. And this particular panel was the immune cells. And you can see some of the immune cells got thumbs up. They reduced their activity. They were in a much happier state. Had just one that upticked a little bit. But overall, his immune system was much more happier now than it was back when he first started. And all we were doing was going back to the food sources and making a lifestyle out of it. 3 meals a day, water in between. And this is a client whose job is traveling around the country. He's an engineer who has to go to different job sites around the country because he works with a national company. He's making this a priority, making it his lifestyle. And that's what we're asking. What is it required to thrive? Understanding the foods are going to be your best delivery of good nutrition and making it a priority to be able to experience a thriving life. Maybe have 1 or 2 minutes for some questions.
If you take a multivitamin, what's likely to be short on?
Well, multivitamins come in a variety of formulas, and this is one of the conundrums in doing research, because they try to do research on multivitamins, but everyone's got a different one that they're trying. What I like to look for is the source of where they get those vitamins, that they come from plant sources. So for example, Megafood is a good brand for multivitamins because they get it all from plant sources. Another one is Garden of Life, are 2 different brands that I like to point to for multivitamins. Okay? And one more question.
Okay, can cholesterol be too low? Because if you were
Cholesterol can be too low, yes. So we want to find that happy medium, and we can do it with foods. Cholesterol is not an enemy of the body. Cholesterol is necessary for making hormones. It's necessary for the structure of your cells. Every one of your cells' membranes requires cholesterol for it to operate correctly. So we do not want the cholesterol to go too low. The teaching or the understanding that it's cholesterol that causes the problem for the blockages is an incorrect understanding. The cholesterol is just trying to bandage a wound. We need to figure out what's creating the wounds and get those wounds healed. Between 180 and 210, I'm very comfortable with, yeah, as a total cholesterol. But then you want to look at the LDL, HDL ratios too. Yeah.
Like for summer, or when it's hot in the winters, I have trouble with the heat. So is there some diet, like drink more water or sodium or something?
Drink more water and drink some of those teas that were mentioned, like the mint tea, some of the other teas that will help to cool things down. I'm going to need to break here, but I will certainly be available after session today.